We use the Compex during the races, but also at training. The riders like to have massages, and obviously they don't have always a physiotherapist with them, so they use the massage function of the Compex device at home. And at minor races, the same thing, like here, the biggest race in the world, at the Tour de France. We use it always when they come to the finish line, afterwards straight away in the bus. So the way we also use Compex is for training. What we do is we use the electrodes exactly at the same positions where we use them for the active recovery process, but mostly on rollers. So the wireless Compex gives us the possibility to train with it without being bothered by the cables. And what they do is they train and set up a muscle strength program. So during their training, they can activate their muscles until a certain level. And when they have these high intensive interval training in the Compex, they can add some extra force on their muscles during this training period. So Compex gives us the possibility to train even harder. And this is the goal these days, to train less, but when you train harder. The pain relief is a good function for the cyclists, especially when they have skin damage. Here at the Tour de France, every cyclist crashes an average of 2.1 times during the whole Tour de France. So they lose a lot of skin. And when this happens, you just very simple put the Compex device around the skin damage, the damaged area, and you turn it on. And then it's much easier to clean the wounds and to cover the wounds, and the cyclists feel less pain, and they're very happy that we use this function to make their life easier off the bike. Compex is very easy to use. We explained, obviously, all riders how to use it. It's super simple. You just put the electrodes like the device shows you and switch it on. It's very simple, it's very easy to use, and all our cyclists know how to use it, and it didn't take long to explain them, and it was really easy to start using it. You can use it for every sport. The football players like it the same like the cyclists do it. When we use it for them in, for example, recovery sessions, it has the same effect, so it's great. But we also use it a lot for rehabilitation and training. For example, after cruciate ligament rupture, you have to make sure that not so much muscle loss is there. And the players really love it. They can use the Compex straight away the first day after surgery. And with this, they reduce the muscle loss, and with this, they are better and quicker back on the pitch. Of course, I have other athletes as well, not only football players and cyclists. The tennis players are big fans of the device because they mostly suffer on pains related to a tennis or a golfer elbow. Everybody knows this, and these pains you can get rid of if you use the eccentric function of the Compex. This is really well. You just put the electrodes very simple on the underarm, and you wait until the device brings your arm in this position and you work against this. It's a perfect function to use the Compex, and it's a very good training for them.